basically what I'm talking about is the risks that you can have if you do not pay attention to the core. Your core is your foundation. It's like that core set of muscles aage piche. Look at this picture, guys. Do you see the all the muscles in red? These are the muscles that make up the core. Okay, now if you see abdominals, this whole thing, yahan pe there is diaphragm. Diaphragm is your primary breathing muscle. People forget that that is also part of your core. That's why your breathing is so critical when you work on your core exercises. Okay, so this is the front of the body. This is the rectus. Okay, this is your obliques and your transverse. There are so many muscles here that we are working with. Now, look at the back. This is glute max. Lower back. Your lower back is also part of the core, which is completely ignored and not paid attention to at all. And this is the mistake that happens when people work with very biased single exercises for the core. These muscles don't get strong at all. And hence we see so much back pain and knee pain. Back pain, knee pain directly associated with each other. We start working on core and activating a few muscles and the knee pain can go away. Okay, so it's sometimes as powerful as that. Look at the side hip muscles. These are your gluteus medius muscle. So none of these actually people work on when they work on the core. They are working at only the rectus, which is the samnika muscle. Now look at the crunch. This is my problem with the crunch, because what are you doing here? अगर समझो इसमें एक्टिवेट हो भी गया रेक्टस, ओके, ये एक्टिवेट हो गया है, but what are you doing? You are overusing your hip flexor. These muscles are also working. You are, because you are lifting your body up, your neck muscles have to work. Something is going to pull you up. If it's not, your rectus is not strong, then something else has to pull you up. That's this. Okay, and now see your spine is going into flexion. Flexion is a movement that your spine doesn't necessarily like, and we already do so much of flexion. Flexion means what? Bending forward. This in essence is bending forward with a lot of compressive forces on the back. So this is my problem with the crunch. Now we know this, that all kinds of things can happen if you don't work on your core. What are the exercises that I dislike? My disclaimer is, if you are an athlete for years together, you have worked on your core already, you are already decently strong to begin with, and now you are doing crunches and these exercises, it's fine. Okay, my problem is with people who newly want to get fit, or for years they've been doing the wrong exercises. Their core is not already strong. How do you know your core is strong, by the way? Somebody has to assess you. You don't know whether your core is strong or not unless you get an assessment done. A sports physio, like we do fitness assessments in the clinic all the time, and they are severely lacking. Core to kisi ka strong nahi hota hai. And people come in and say, no, we do thousands of crunches, we do deadlift, to itna utha lete hain, deadlift mein bahut acha core hai, strong hai. When I check it, then they get surprised. Okay, so my disclaimer, you got my disclaimer? If you are already decently strong with, if you've gotten an assessment done, if your physio has told you that your core is strong, by all means do this. No problem, go for it. Okay, but if you haven't done that, then please understand that these exercises might be doing you more harm than good.